DocTalk. We've made it to the middle of June. It seems all the schools are out, and we're in the middle of a first significant heat wave moving across the country. Although last week I saw there were still blizzard warnings in part of upper Montana. So I know the weather just still doesn't know what to do across the country. I know that COVID knows what to do now, and that is cause little bursts of disease. But it would appear that we are not seeing the dramatic number of cases arise in this wave. Nationally, the statistics this week said the U.S. has leveled off. And after what they're calling the spring wave, which will be called the Omicron wave, that we, even though we have the infectious versions, which are the BA4, BA5, now the predominant variant in the country, it would appear that with so many people having had the disease, vaccinated or both, that we are not seeing those secondary waves get carried through. So let's talk about this for a minute. We have had some outbreaks, and let's just say for our fire EMS crews across the country that I'm involved in, and here today at the Eagles meeting, we're discussing our waves over the last couple of months. And it is, we will get no cases, and then we will have a burst of cases, and a number of people will have the disease. They will have relatively minor, typically upper respiratory symptoms. And you're like, oh no, here we go again. Fortunately, in most of those cases, people are getting back to their health relatively quickly. Haven't had long COVID cases burst out of that. But most importantly, and what's really kind of odd, those people will go home, they'll do their 5-day of isolation, they'll do their 5 days in a mask or otherwise away from people, and we're not getting the secondary bursts at all. It just disappears again. And then, you know, seemingly a month later, 4 to 6 weeks later, another little blip, and then it's gone, and another little blip, and it's gone. So what that means is the new variants, still very contagious, still a risk, a minor risk to people who've already been vaccinated or had the disease or both. But they're not very infectious to other people, so that we're not getting the follow-up waves because our protections are too good for us to be able to congregate enough of that to give it to other people. So that's a little different in the variant this time through. Again, the statistics right now say across the country that we are past the spring wave, and past the spring wave, we are going to go into another lull period as we go into the summer. That's a good thing. The infectious news of the week that really is of concern to most of you is our other bugs, our other respiratory bugs are carrying on in ways that is not expected. And you're hearing about non-seasonal influenza, non-seasonal RSV, non-seasonal strep, and some of the other respiratory bugs. That is significant for all of us because ordinarily it's middle June. We're not thinking about respiratory infections. We are not thinking about people having anything at this point of the year that's respiratory other than their allergies going crazy because there's so much dust in the air. It's dry and windy, which kicks up any pollens that are left around from springtime. And typically we wouldn't even be thinking about influenza. Nonetheless, in some places there's influenza spreading. Nonetheless, in some nursing homes and other places where we have people who are chronically debilitated, they can get influenza. It can be risky to them. We have some COVID in the hospital. That those COVID cases in EMS and in the hospital have a tendency to be very compromised people, and they occasionally, although our death rates are so far down, occasionally some of those people get sick with their underlying disease and they die. The COVID cases that are occurring now have a tendency to be less sick and to not end up as frequently in the hospital other than those people who are compromised. The other bugs we would typically not be thinking about, and that's influenza, RSV in the kids, strep, and some of the other respiratory bugs that ordinarily would not be circulating. Bottom line for us in fire EMS, wear a mask. Be careful around people. Limit the number of people within 6 feet. Don't do anything in the face of the patient that you don't need to do. And be careful, and then cleaning the air in the back of your medic unit when you've taken people to the hospital. So those are things we should be doing anyway across the year. We still have other infectious diseases that can spread this time of the year. The GI bugs in some places are going crazy. And we are now headed into a period of time where heat waves are a real problem. Yesterday was a record heat day in some of the areas of the Midwest. A storm line had gone through places like Ohio, and yesterday Columbus, Ohio, had the storm line knock out a number of the big transmission lines that relate to their power sources, and Columbus, Ohio was going through periods of rolling blackouts, which is not something typical for Midwestern cities. That's, unfortunately a California thing. Occasionally it happens in the tropical storm zones, but it was record heat yesterday in Columbus, Ohio, and a lot of places without any power. It knocked out a number of the senior citizen places. It trapped people in elevators. And so Columbus, Ohio, and similar areas yesterday had terrible days. We're at the beginning of the summer. And so for all of us, remember how important it is to acclimate yourself to the heat. So you got to get out there in it. We're at the beginning of the summer in these 90 and 100-degree days. You got to get acclimated to it. You got to hydrate yourself well. You have to keep your calorie intake high, because keeping some calories in your body allows you to retain more fluids. That's an old wildland firefighter trick. If you don't eat, you have a tendency to pee out all of the fluids that you take in, and it doesn't result in you being in full ability to do your job as a wildland firefighter. So you have to get both calories and fluids in, and then acclimate yourself to the hot temperatures, obviously to the sun, still wearing your sunblock, and stay healthy across this beautiful time of the year when we're heading into the summer. Be aware, our patients are still facing this in some areas of the country. They still have some extra long wave of the COVID. Again, not compromising hospitals, but resulting in people having to wear their masks a little further into the summer than they would ordinarily want to. As we fully get into summer and prepare for 4th of July, we have to think about things like fireworks, incidents, and other things. Man, we got to be careful. And with a lot of areas so dry this year, please urge your community and each of you stay safe as we head into fireworks season. So COVID on the downturn. This week, the one piece of news I really did want to share with you related to COVID is the FDA is ready to approve, for emergency use authorization, the vaccines down to 6 months of age. So the advisors yesterday approved both Pfizer and Moderna vaccines down to 6 months of age. It is likely the full FDA emergency use authorization will be approved within days. It will then go to the CDC. And as of now, the federal government and local areas have begun to put together vaccine programs that will take us down to 6 months of age. For a number of you, you've been waiting for this. Moderna last week was approved, emergency use authorization. So Moderna down to 6 years of age. And then we've had that gap in the 6 month to 6 year. And now we will have likely both the Pfizer and the Moderna vaccines approved down to 6 months of age. And at 6 months of age, we will be able to vaccinate almost our entire population. Okay, so our challenge and our opportunity is by the next respiratory season. So let's be thinking end of September, October, November, that we will have an entire population that will be able to be vaccinated against COVID down to 6 months of age. We will talk this fall, starting in June, we will be talking about the importance of getting influenza vaccination this year. It will be a critical year for us to have as many people as possible vaccinated against the flu. The children will be able to be vaccinated before they return to school. What a critical item that will be. And so then we'll be out of the masks and away from, social distancing and other things that frankly have compromised the education and the socialization of our little kids. So parents now, including our fire EMS parents, will be comfortable sending their kids into daycare, into schools, without the fear that there are going to be widespread outbreaks of dangerous COVID. That will be important as we head into the school season. And then as we head into respiratory season, protection against COVID, influenza, and then if we need to, protections that would come from other respiratory bugs going through this winter. I hope by the fall we're not worried so much about masking up, about going to our usual social events as we head in. That would be a wonderful element to this fall. So it's June. Prepare for the heat. Enjoy the 4th of July weekend. Make some plans for it now. With cases going down nationally, that means we have a lot of opportunity to celebrate with our communities. If things go really well, our Labor Day will be spent talking about our freedoms. Finally, the freedom to be able to enjoy the country, to travel, restore our supply chains, restore our usual life moving into the fall. That would be a blessing for all of us if we get there. So middle of June, DocTalk, another week. Stay healthy.